name is Joycelynn, and I will be giving a speech on alcohol abuse. In alcohol abuse, a person continues to drink even though they have significant problems in his or her life. Definite signs of alcohol abuse includes unable to stop drinking, needs to drink more, spends a lot of time drinking, continues to drink even though it causes problems in their health and relationships, and withdrawals after abstaining from alcohol. Some of the alcohol withdrawal symptoms include anxiety, irritability, emotional changes, shakiness, a jumpy or pulsating headache. And these alcohol withdrawal symptoms can be found at ehow.com. Prolonged alcohol abuse causes many. First of all, we're going to say what the causes for alcohol abuse. The causes for alcohol abuse includes genetics, early exposure, physical, social, and emotional factors, and environmental influences. Prolonged alcohol abuse causes many problems that could be detrimental and devastating to your health. Some of the problems include mental health, which include depression, anxiety, bipolar, and schizophrenia. Physical problems would be seizures, delirium, dementia, stroke, and peripheral neuropathy. Some problems causes GI problems, which is gastrointestinal problems, would be gastritis, peptic ulcer, acid reflux, esophageal cancer. And then we have the cardiovascular problems that alcohol abuse can cause, which is high blood pressure, arrhythmia, which is an irregular heartbeat, cardiomyopathy, which is an enlarged heart. Other problems is the pancreatic disorders, which is pancreatitis and cancer of the pancreas. And then we have the liver disorders, which is hepatitis and cirrhosis of the liver. All these problems can be detrimental to your health and even can eventually cause death. Okay. Alcohol abuse on the genetic side, if you start to drink early, the earlier you start to drink alcohol, the more you're predisposed to abusing alcohol. But alcohol is a family. It could be a family and a cultural tradition. So people tend to experiment with alcohol at an early age. Some of the treatments of alcohol abuse includes stopping drinking would be the best prevention to alcohol abuse. Then we have group therapy. We have counseling. We have Alcoholic Anonymous, which is a very effective program that have helped people who have alcohol abuse problems. We have medications that can help people with alcohol abuse problems. Anti-abuse is one. Anti-abuse is a medication that when you take it while you drink, it causes you to have an upset stomach. Revia is another medication, and when you take that and use alcohol, it just takes the pleasure of wanting alcohol away. Camprol is another one, and it just takes away the craving for alcohol. We also have rehabilitation for detoxification, which a lot of people can go into programs, rehabs that kind of takes them out of the environment they're in so they can stop drinking alcohol, and it teaches them ways to cope with just abstaining from drinking alcohol. And this is just treatments that will prevent a person from having, causing further problems in their life from drinking alcohol. People who have parents or siblings with alcohol abuse problems are 2 to 4 times more likely to abuse alcohol compared to somebody who does not have a relative with an alcohol abuse problem. Alcohol is a part of many people's life and has a place in culture and family traditions. Sadly, it can sometimes be hard to know when you begin to drink too much, because you begin experimenting with it and then having fun with it, and then before you know it, you just become abusive. Some people develop alcohol abuse even when no one in the family has an alcohol abuse problem, and not all children who have a parent or a sibling with alcohol abuse problem becomes abusive with alcohol. The statistics on alcohol abuse, the U.S. government agencies say that 13.7 to 23.5% of the general population are affected during their lifetime in the United States by alcohol. Alcohol abuse is a psychiatric problem. Adolescents is of the greater risk because adolescents are more inclined to risky behavior, so that makes them more prone to abusing alcohol. Age, the earlier you start using alcohol, the more likely you will start to abuse it. The deaths from alcohol abuse occur more during the 4th of July, Christmas, and New Year's. According to the U.S. government and U.S. National Institute of Alcohol Abuse and Alcoholism, they say that 40% of the traffic accident that occurs during Christmas and New Year's is due to drunk driving. Okay, and anybody that, choose to start drinking at a young age should take into consideration the how to drink, not to start drinking a lot, and to drink in moderation, and should recognize the signs of when they're drinking too much, and try to seek help if you think it's becoming a problem, because help is out there. We have different treatment places that you can go to get help. With alcohol abuse, and where some of these diseases that affect or problems that affect your health with alcohol abuse, you can go to pdrhealth.com. It'll list those diseases and all those problems that comes from alcohol abuse. And the number one prevention, the one thing to remember is the number one prevention of alcohol abuse is prevention. So it's best for you to stop drinking early, not to drink too much, and to just know your limits so it don't become a problem that can affect your life later.